Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes the deep interconnectedness of animal, environmental, and human health, affirming that a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become custodians of their own well-being. Through our hybrid Learn to Earn sessions, conducted both virtually via Google Meet and at physical locations, we engage participants from diverse backgrounds. These weekly sessions serve as dynamic platforms for learning, discussion, and collaboration. We focus on the co-creation of knowledge through the Learn One, Do One, Teach One approach. This method ensures that each participant not only learns valuable health information, but also applies it and teaches it to others, fostering a ripple effect of empowerment and education. By participating in the Actuate Health Access Program, individuals gain the tools and knowledge needed to improve their health and the health of their communities. Our goal is to create a network of informed and proactive health custodians who can address health challenges in a sustainable and impactful way. Join us in this journey towards better health for all. Together, we can make a difference. Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes the deep interconnectedness of animal, environmental, and human health, affirming that a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become custodians of their own well-being. Through our hybrid Learn to Earn sessions, conducted both virtually via Google Meet and at physical locations, we engage participants from diverse backgrounds. These weekly sessions serve as dynamic platforms for learning, discussion, and collaboration. We focus on the co-creation of knowledge through the Learn One, Do One, Teach One approach. This method ensures that each participant not only learns valuable health information, but also applies it and teaches it to others, fostering a ripple effect of empowerment and education. By participating in the Actuate Health Access Program, individuals gain the tools and knowledge needed to improve their health and the health of their communities. Our goal is to create a network of informed
Hello, good evening. Hello, Frida, kindly confirm whether you can hear me.
Yes, we can hear you. Glory. Hi, Glory, go ahead.
Hello, okay. Good evening, everyone, and welcome to today's health access session. And as you have heard in the video that has recently played, we continue to champion for our project's goal, which is to empower individuals to be custodians of their own well-being through these learning sessions, because we know that information is power and change begins through people getting the relevant information. So In our previous session, last week's session, we discussed about the importance of Actuate token in community health. And we saw how this token can be used to power community health projects, ensuring the overall health of the community. So our today's topic now extends to the national health, how this token can be used to promote national health. So before we start the discussion, allow me to take you through the meeting agenda. So we will start by the topic presentation by our topic master, who is Daudi Maingi. And then after that, we will have an interactive, after topic master's presentation, we will have additional comments from our CEO, Dr. Masharia, and then after that, we will have an interactive session. Thereafter, we will have a pre-Boston Nairobi Summit announcement by the summit president, Augustine Narokwe. So now allow me to welcome our topic master to go on with the topic presentation.
Nifungulie. Ndio. Thank you, Glory. Thank you, Glory, for the warm welcome. I'll be standing in for David. I think he has got a problem issue from where he is. Today's topic is talking about the Actuate token. The Actuate token can play a crucial role in national health systems by leveraging blockchain technology to improve efficiency, transparency, and accessibility in healthcare. Here's an overview of its potential importance. First, health data management. The Actuate token can be used to incentivize the secure exchange and management of patient health data across various healthcare providers. This ensures that patients' records are stored on a decentralized ledger, making them tamper-proof and easily accessible across the country, improving diagnosis and treatment. Secondly, that's the transparency and accountability. Using blockchain and the Actuate token in national health systems increases transparency in funding and the flow of medical supplies. Governments can track the distribution of funds, ensuring that they reach the intended recipients, such as hospitals and health facilities, which, while reducing corruption and misuse of resources. The third is incentivizing public health initiatives. The Actuate token can encourage people to participate in preventive health programs by rewarding them for activities like regular checkups, vaccinations, or adhere to health guidelines. This promotes proactive healthcare rather than reactive treatment, reducing disease burdens. The fourth is facilitating payments and health coverage. Through smart contracts, Actuate token can be used to streamline insurance claims and payments. Patients could use these tokens to pay for services or as part of health coverage programs, ensuring faster, more transparent transactions in national health systems. The fifth is the funding research and development. Actuate token could also fund health research projects by offering retroactive rewards to public goods such as medical research breakthroughs. These incentivize innovation, and help speed up progress in areas like drug developments, vaccines, and advanced medical treatments. The sixth is improving access to healthcare. By integrating the Actuate token into the health sector, rural and underserved areas could receive resources more efficiently. The tokens can be used to fund telemedicine projects or improve access to health services by supporting decentralized health delivery systems. In summary, the Actuate token's potential role in national health includes promoting efficiency, transparency, and equitable access, and improving the quality of care through blockchain-powered innovation. Thank you, Glory, and that's the end of the presentation.
Thank you, Anthony, for that presentation. I will welcome Daktari to give more remarks about the topic. Daktari, you're welcome.
All right. Good evening, everyone. Glory, Mr. Ronald Anthony. I know people here, good evening to you. So, national health is something of national health concern. It's a national health concern. That's of health of everybody in the nation. And that is usually a very difficult goal to achieve in the centralized finance system. But it becomes possible to achieve in the decentralized finance system because of the reasons that Anthony has told us. Now, Professor Anthony. So, national health, as you know, it relies upon our ability to gather good data about people, which becomes health data, so that we can make decisions. You know, decisions, all decisions you make in life depend upon the data you have. Okay, so when the data is not complete, you are going to make incomplete decisions. And today, we don't have, not in any nation, we don't have the capability to get enough data about every individual in the nation. Yeah, particularly for health, we just don't have it. So a lot of people are outside the system, which would call the system. You know, in the finance system, people who are outside the system, you see that they are unbanked. People who are outside the eyes of the government or the purview of the government, and they usually never even pay taxes. They are known as extra legal population. So they're outside the law. They're not illegal because they are not illegal citizens or illegal aliens or illegal people. They are just outside because the government does not have the technology to reach those people. And you know that even when it comes to the government collecting taxes, you know, taxation, the number of people who pay taxes in a country like Kenya is very small compared to the general population. You could see the people who could pay taxes, the population, let's call it the taxable population, people who could have a job at the age of 18 to 65, who are actually in the system where the government can access them to pay taxes, is less than 10% of the taxable population. That 90% are outside the eyes of the government. And this is not because these people are hiding. They're just in the open. Yeah, but the government doesn't have the technology to reach those people. It is technology, it's a technology problem. It is not a problem with the government. Yet, those people, all of them have got cell phones, all of them. But you see, having a cell phone does not mean that the government knows that you are old enough to pay taxes. Okay? And so there's a huge mismatch between who can access information and who the government can access to say that this person belongs to us as a taxable citizen. And so, and of course, the other problem is that in order for government to collect taxes, the citizens themselves have to make money. They have to have revenue, a source of revenue. That means they are making money. Now, the reason the government would even shy from trying to find out who these people are is because it is not creating jobs for the people. You see that? The government's job, meaning to say the people in the government, instead of creating jobs or encouraging job creation, right now what you're seeing with our government is to export people to go and look for jobs created by governments elsewhere. Can you believe that? It is shocking. I heard earlier this week that our president has negotiated with the German government for 250,000 jobs in Germany, not in Kenya. Where did those jobs come from? It means the German people created those jobs. And see, that's the only thing that we need to do, create jobs within our own country, so that those people don't have to be shipped out there. So that, and you see, so what you're seeing, national health will not occur if we are not helping people have revenue. Yeah, so that they can get included in the bracket of the citizens. They become now citizens by right, economic citizens. So you can talk about economic citizenship. So what what the blockchain is capable of doing is creating economic citizenship. That people are they are legally in the nation, economically. They're legally in the nation. We don't have to think about exporting the people so that they can go and find jobs out there. But the people are legally in the nation because they have money. And the money is the things, it's the legal tender. They have the legal tender to be in the nation. But see, that legal tender designation, or say the fiat currency like Kenya shilling, is misleading because it means that there are some people are extra legal because the government doesn't see them, or the economic eye of the government does not include them. They are excluded. So even when they are collecting data about people for health purposes, a lot of those people who are extra legal are left out. But those people, it doesn't mean that they are not going to have health needs or the needs for healthcare. Okay, they're still going to show up in the hospitals even if they don't pay taxes. So if they don't pay taxes, they're not going to be contributing to the national hospital insurance funds, because that NHIF, you pay money that you're earning from your salary. Now, if you don't have a salary, how can you be paying NHIF? And then when you go to the hospital, they want you to have NHIF. And so you can see that's a huge adventure in missing the points, because those people stay extra legal, and they are very, very many. It's the largest part of the national population. So insurance coverage becomes impossible. It is impossible to have insurance coverage in the traditional finance system, which is centralized finance. Centralized finance is incongruent with something called universal coverage. So, and this is where Actuate token comes in, because Actuate token is on the blockchain and it's distributed through the cell phone, which, as we said, every household has got a cell phone. See, that means it's possible to reach the entire census, the entire population of a nation through the blockchain. And the Actuate token also becomes a way of earning money. That means that, as we're talking about every transaction that you conduct, we'll be setting aside a small fraction of that transaction into a health risk pool. So creating a health insurance, a prepaid insurance or insurance coverage. And that way we can get universal coverage. That's mean universal health access, that the entire nation gets covered because the blockchain has got that capability. Right now, today, governments are not capable of providing universal coverage because of the reasons we have said. Just because they do not have in their purview all the citizens of the nation. Because the way they look at citizens is from people having jobs, working, contributing. If 90% of the people are not working, they don't have formal jobs. Maybe they are working, but they're doing things that are not formal. We call either juakali, or they're doing substantive cropping. There's subsistence farming, out there and they're selling their sugarcane or selling their chicken, selling their goats. How do you include those people into the tax bracket so that now you can include them in the NHIF? If somebody just goes and sells one goat or sells a whole bunch of chicken or sells eggs, how does that transaction, how do those transactions contribute to the NHIF? Unless you employ the NHIF police to go telling people, if you sell chicken, you have to put some money in. But you see, that is not necessary when you have the blockchain, because the blockchain itself will be collecting from every transaction. When you're selling the chicken, a very tiny fraction, just like the transaction fee, a very tiny fraction, which is unnoticeable to the seller, goes into a health risk pool, and that health risk pool provides the basis for a health insurance, such that when you go to the hospital or you go to see a clinical provider, you just show your QR code, they scan it, and then you get the treatment you need. So you see that's one power that the blockchain has that supersedes and trances the entire central finance system, particularly in healthcare provision. And we have to work very hard to implement that. And as I keep saying, in order for that to work, we have to mobilize hundreds upon hundreds of people to join the Actuate Nation, to call them in, because it's, as we have said in the previous sessions, the minimum numbers needed to get such a universal health coverage coming in is about 100,000 people. So what does that mean? That everybody who is here, you have a job to tell as many people as possible to join Actuate Nation. Invite people through social media, like Facebook, WhatsApp. Invite them to WhatsApp group in the WhatsApp Nation. WhatsApp Actuate Nation, and let us spread the word, even using Twitter, or social media. And because we have a lot of material to spread the word everywhere. When you do this, so we have to have a very intensive mobilization campaign where we are spreading the word like wildfire to the whole nation, so that everybody must have at least interacted with Actuate token itself, because it is by having a wallet, and then the Actuate token is inside the wallet, and you want to use that Actuate token just for any transaction. Now the smart contract will set aside a small fraction of that transaction. That's a transaction fee. That's what it looks like. It sets that money into a liquidity pool. Okay. Now, unless we mobilize people, we mobilize unapologetically throughout the nation, just mobilize people, then what we are talking about is the health of nation will not manifest. Then it's going to manifest because we are going to mobilize people. We are not going to sit on our hands. We're not going to sit on our hands and say, okay, that is just all talks. It's not all talks, because the technology is here, the cell phones are here. People have got, people can put wallets. The wallets are free. Nobody buys a crypto wallet. They are not sold for money. And say like Trust Wallet, MetaMask, or even Silver Wallet that is good for USSD phone. So for those people will be asking, what about people with a feature phone, the USSD, what are they going to do? Yes, they are also included, because the Silver Foundation has created a USSD wallet that operates just like M-Pesa wallet that operates on what? On a feature phone, on a Mulika Mwizi. So because the technology is there, the only reason for this thing not to happen is for us not to spread the word. That's what we're here. So you want to spread the word to all the people you know in your network and tell them this good news, because it's good news. I think when it comes now 2025 going forward, we have a spirited campaign that is going on county by county, getting people in, and we use all the means necessary to educate people about this good news. Okay, meaning that besides going on the ground county by county and region by region, we also do a lot of work in educating people through meetings like this, Zoom meetings, Google Meets, and also having in-person visits. And as you can see, one of the reasons for the summit is that type of mobilization, the summit we have in December. Because before people can accept to open wallets, because there's a lot of negativity when something new comes around, we have to communicate even to people who are high-profile professionals so that they can pass the word to the people, to the masses. And that is the other way we are going to mobilize people, through our high-profile professionals, because for as long as the high-profile professionals understand, they will break down this good news to the people, to wananchi, to people in the country. Yeah, so that people understand that the tokens themselves have got that power within them. They have built, they're built with that power, because as we say always, that these tokens are built with new science of randomization, the new economics of randomness. New economics of randomness, unlike the old economy that guides the traditional finance system. And it's this new economy of randomness that is able to reach people at the farthest corner, the most remote corner in the country. So there is nobody, when you're on the information system, right now, the way we are right now here, there's no one who is remote to the other, because you're on the same place, although we are all in different locations. So the idea of remote location disappears when it comes to the information system. Okay, so nobody is remote to the other, because we can meet into the cyberspace. Cyberspace has no remote location. Those are no geographical boundaries. So even if somebody's in the mountains, the other one is the city, if there's the cyberspace, they're in the same place. Okay, and that is the power of this information, this new economy, which can reach people everywhere they are. And that, because we are able to reach people everywhere they are, so we have to actively distribute the good news, distribute the Actuate token by helping people out there in the community to open wallets, get wallets, and receive Actuate tokens. And you see, besides that, there are many other benefits, as Anthony has told us about the health data itself, the collecting health data for the patients, for the people who are healthy, and even for the patients, becomes possible for making public health decisions, for organizing preventive care. Before the diseases even emerge, we can be able to capture them and knock them out of here, because you have access to the people. And then even pandemics, or let's say epidemics, before they arise, we shall be able to capture them because of that, because of having access to people. What becomes an epidemic usually starts somewhere. The reason why epidemics spread is because when the epidemic is starting, people don't know what's going on, because the people who are getting affected by the epidemic do not contribute any information. So usually the epidemics, we come back later to say, oh, that was the epicenter. It's after the fact, because the centralized finance system does not have the capacity to recognize an epidemic before it breaks out. It's only after the outbreak that we say, okay, that was the center of the outbreak. And then you say, how do we prevent such things from happening in the future? So it is always behind. So the centralized finance system is always behind the epidemics. That is why viruses like coronavirus can spread from China to the whole world. And then everybody is running around saying, what are we going to do? And the virus is here. The virus was not hiding. The virus wasn't hiding. It was just traveling but killing people in its wake. But as it is doing that, people, first of all, they don't even know what's going on. But it's because the virus itself, being a packet of information that is densely packed with information, does not care about the centralized finance system, which does not recognize information. See that the centralized finance system is built on the physical world, the world of Caesar, the physical world with coins and paper. But it does not recognize information which is non-physical. The information is virtual. Okay? Because information is non-physical, then a virus can operate in that non-physical environment where it's not detectable by the physical means. But information itself, being information, it will detect another information. So the blockchain itself has got the capability of capturing the movement of a virus before it even gets out of one small community to affect to another community. It is and those, I think we're going to be talking about that in the next session about global health. Is it how would the blockchain detect an epidemic before it becomes an epidemic so that you can stop it? So, and you see, now even in a national level, you have epidemics happening in nations. Like you can have cholera happening somewhere in Kibera and spreads around. If you have the blockchain technology, it will be able to pick that up in a jiffy. And then you can have interventions pouring down in an instant so that you can stop that epidemic from going on right there in its track. Okay? Because information can detect information, but the physical world cannot detect information. Now I am led to explain something that Matthew said. You remember Matthew in the book of Matthew, the New Testament? He said, the spirit is born by spirit, or the spirit gives birth to spirit, and flesh gives birth to flesh. See, things that are of the same kind, like spirit, we recognize spiritual things. Things that are based of flesh, we recognize things of flesh. But you cannot expect flesh to recognize spirit, or vice versa. That's written in Matthew. Now, if you understand that, that implies that if we create a technology that is based on the physical world, let's call it flesh here for symbolic purposes, for explanation. The technology that detects things in the physical world, these things are like coins and paper, based on the centralized finance system. And then you expect them to detect things that have information technology. They are not going to recognize it. And just understand, that's why this thing is called incongruence. Incongruence of formation. That the form that you can say operates, the form that operates the information system, and the form we're talking about is the mathematical sequence, the mathematic or the theoretical basis of the mathematics of information system. As you have said, the theoretical basis for the mathematical information system is called entropy, okay, or the mathematics of randomness, okay. So they are so different from the mathematics of what's called predictability, or maybe let's say the deterministic mathematics which guide the present day economics. It's deterministic. Determinism means that something is determined by something else. You already know what it is. That means that for you to know about an epidemic, you ought to have known that an epidemic would arise. So that's kind of backward looking. And so because it is deterministic, you say that because epidemics arises in this kind of conditions, then this kind of condition are likely to produce an epidemic. That is known as deterministic. Because of A, then B. That determinism is very totally incongruent with how diseases arise. Diseases are not predetermined. Diseases or even health problems, they happen spontaneously and even randomly. So disease, like for someone to say that, okay, because I think that by the age, by the time I'm age 25, I'll have diabetes, or maybe I'll have schizophrenia. Can you believe that nobody knows whether by the time you get 25 or even 26, you'll be having diabetes? No, nobody knows that. When diabetes comes, it comes on its own. If schizophrenia comes, it comes. So it is not predictable. You see, it is not determinable. You know, it's not determinable a posteriori, like in you could say. And so this is why the whole thing doesn't work. That the whole mathematics is backward when it comes, and that mathematics is based on the old system of math, which was good. It has served us a lot because it gave us industrial evolution. It gave us chemistry, physics. See, the physics came from Mr. Isaac Newton in 1659 or something like that. So that mathematics or Newtonian mathematics, which is what the system of the economic system of the world is built, does not work for health issues. Okay? Because health issues are random. To say that I can live until the age of 110, you cannot tell that, you cannot predict that nobody can predict what is going to happen to you health-wise, even in the next day. And because these health issues are very random in their emergence and their occurrence, then even epidemics arising are very random in their occurrence. And so the need for healthcare, the need for health care for yourself to receive health is random, is unpredictable. So the only science that comprehends that is the science of unpredictability, or the science of randomness. Okay, the science of non-determinism. You cannot determine it ahead of time. That science is called the entropy, which is the science of disorder and disequilibrium. Meaning that if we now go to the old system, which is the science of equilibrium, because economists in the old economics, traditional economics, with the centralized economics, are trying to draw equilibrium equations. And if everything it becomes equal, then they say we are fine, that's good to go. But and that creates, now we can calculate the demand of health services of a nation based on such mathematics of equilibrium. And such mathematics, as you can see, they don't cover everybody. They leave 90% of the population outside the equation. That is just how inadequate it is, 90%. Now, let me ask you, if you had a student, you're a teacher, and the student comes and only, you give that student an exam, and it passes only 10 questions, out of 100 questions, the 90 questions, they don't pass those questions. Are you going to say that student is very good? Or are you going to say, first of all, which grade would you give that student? Are you going to give that student a grade A, B, C, D, E, or F? See, the answer to the question is that it's a straight up F. Can you believe today the theory of economics which we rely upon to administer health care is based on the ability to recognize 10% of the taxable population? What is 10%? What is 10%? 10% is an F. That means it's a failed model. It's a failed economic model. But then if you talk to all these guys in the traditional finance, they are going to say we are doing very well. Yeah, because them they are rich, but everybody else is poor. Okay? So they're only able, in this traditional finance system, they're only able to capture 10% of the taxable population. The rest of the people are extra legal. And I tell you, this is not because these people are hiding. The problem is the incongruence of the theory that underpins their economic system, which is based on old mathematics, mathematics of physical world, mathematics of the, physics, mathematics, and you see that mechanical engineering, that's good. That's the first theory of thermodynamics, that's good. It works very well. This is Newtonian math. But now when it comes to information, it's a new math. Now, what is shocking to all of us here at Actuate, maybe a few people outside, is that this mathematics of randomness is not new. It has been around since 1940s. Yeah, and of course, it is the basis on which computer science developed. And then you have seen large computer companies like Google, Microsoft, Apple computers, even the blockchain itself coming along. But that mathematics has never entered into the consciousness of people in economics. Why? I don't know. But are we going to sit and wait until they get it? Or are we just going to roll out the mathematics of randomness? We roll out the actual token. Because if they're sitting there still, working on their old math of the Newtonian economics, as they're still doing that, people are dying of diseases that we know how to treat, just because they don't have access. So the blockchain itself, this new economic of math, is able to get everybody like universal coverage. See, universal, everybody gets coverage because it is administered through the information system, which is on a phone, and everybody has got a phone. And on that phone, you put a wallet, and the whole thing works like that. I hope I have convinced you enough to understand that it is the time to move away from that old technology. It's not helping anybody, including those people in a centralized finance system. It's not helping them, because you cannot help a few people and then you don't help 90% of the people, and then you think you're helping yourself, because in that 90%, they included a lot of people you will be knowing who are going to be your relatives, your sisters, your brothers, aunties, your grandmothers are going to be in that extra legal space. So it becomes, why don't we all go into the new legal space where the legality here is a smart contract? This smart contract is a legal contract, just like any legal contract that's drawn up by lawyers. But this is a legal contract on the information system. So it helps to legalize the work of the people out there who are extra legal. And then they come in to the system and they become included, then so we can have universal coverage for everyone in the nation. So and then we create healthy nations that way, when everyone is covered. So that's what I would like to add about that. I think it's a very, very, very important conversation that we want to make sure that we drill down into it, just to the bare bones of this idea, the blockchain, so that those people who are resisting it, you'll be saying, and why were we resisting? Yeah, because so that we can only take care of 10% and now take care of the 90%, so that we can create poverty, as we are saying, we're creating coverage. Because I can tell you that covering 10% just produces what? Poverty. Because it's like planting thorn seeds to expect to grow oranges. So if you plant thorns, you have a thorn, you have fruits. The thorn fruits from the thorn tree, isn't it? That's the thing. So that, I think that's, I hope that you understand that. Are there any questions so that we can, if you have questions, discuss it. But I think there's something that we need to unpack because it's very, very deep stuff. But then you see resistance coming from a lot of people who resist tokens. saying they're crypto because it's a cryptocurrency has got all this negative speech, but that it does not, this negative speech is because of it's a different science. It's a different science, the science of randomness. And so for people who do not understand that, will be thinking is what? It's something, they'll be saying whatever they want to say. I can't tell you what they say. They say a lot of things. Yeah. Okay. So that is the situation. Back to you, Glory.
Wow, thank you, Daktari, for emphasis about the importance of Actuate token and how we can really use blockchain to ensure health access for all that, apart from now funding healthcare and making it accessible to everyone despite of their economic status, because of his inclusivity aspect. Daktari has also emphasized about now the disease preparedness or epidemics preparedness, where blockchain technology can be used to detect these epidemics early enough. And of course, if there is early detection, there will be early interventions and preventing these epidemic, preventing them from causing harm, and ensuring and promoting health for all. And I believe that if this conversation is everywhere, if everyone adopts this technology, everyone everywhere in the country, everywhere in Africa, I believe that healthcare accessibility will be no more a problem. We will start talking about other issues, but not healthcare accessibility. And this can only be achieved by people adopting this new technology, and by people abandoning the traditional funding mechanisms. And this can only be possible if everyone who attends these sessions becomes an ambassador for this innovative model, for this conversation. Yes, so in case you have any question, you can type it or you can raise your hand to speak. And meanwhile, as you prepare for your questions, I will welcome Augustine, who is our president for the pre-Boston Nairobi Summit, to give us the updates about the summit, where we are. Yeah, so Augustine, welcome.
Thank you so much, Glory. And thank you so much, our topic master, Ronald, and also Doc, for making time to join us this evening for Health Access Learn-to-Earn session. So, as we all know, we have the Actuate pre-Boston Nairobi Summit. It's an upcoming conference at KU. It will be as from 3rd to 6th December this year. And it's an event whereby we are aiming to bring together stakeholders and facilitate idea sharing and collaboration at the end of the day on how we can take Africa and even the globe to the next level in terms of healthcare development and even human development, using these emerging technologies, the Web3, that is artificial intelligence, blockchain technology, and decentralized finance. So it's a really, really a big event. It's really a very important and impactful event at the end of the day, because 99% of the challenges we're facing right now are clearly possible to be sorted out when we embrace this technology. So Actuate Biomedicine is a pioneering platform to lead Africa to stay ahead of the curve in terms of health and human development, because there's so many gaps in the healthcare sector, right from affordability, quality, and even availability of health. It's really a challenge, and this technology holds immense potential in solving these issues. And so, as you see, basically, this summit is all about health access, when you look at it, because it's a catalyst for change. Okay, we want to create more equitable future in healthcare system. We want to create more efficient healthcare system in Africa. We want to make to create an accessible healthcare system in Africa. So this faucet, Actuate health access faucet, is very significant, and I think it is very centered to this summit. So it's very much important faucet, and I think it has a great role, and it's gonna be much represented. And I think by the time this summit arrives, we want to evaluate how far we are. Okay, this year, what have we achieved in this faucet? And right now we are into imparting knowledge about the health access or healthcare access. Yeah. So just know that we are going to evaluate what we have been doing in this faucet, and also now start exploring frontiers on what next. Okay. Yes. So it's an important summit for this faucet. So we are going to have a workshop for health access, and there will be workshop for health access. It will be run by a specific organization. Although we are not yet there, we have a lot of options, but I think by the end of this month, I think we will have a workshop organization or a company running that workshop. So I want to encourage our members, okay, to please register. We want a lot of audience. Help us invite your network to attend this workshop. There is a lot to learn about health access in this workshop. So the challenge today is spread this word about health access workshop. Bring your network, bring your people you know, where you you are taking your internship, your attachment, or even institutions. We want to collaborate with institutions to give us or to help mobilize people for these workshops. Okay, so kindly, you need to work closely with the Glory so that if you are in any institution in Kenya, any learning, any academic institution in Kenya, help us get access to these colleges or these faculties, the health faculties, health sciences faculties, because we need a lot of audience to come and learn, acquire ideas, acquire insights, network, with these people, these thought leaders, industry leaders, on how we can create a more equitable future, more brighter, more healthier, okay, using these technologies. So that is something I urge each and every one of us. Please spread the word about health access workshop, post, tell your friends, bring your friends on board. I think there is health access WhatsApp group and even the LinkedIn. Please bring people on board. Let's all be evangelists for Actuate Foundation for health access. Okay. So that is the workshop. We are also partnering with various people for sponsorship. Bring us people in healthcare sector, health access, those are focusing on affordability, those people focusing on accessibility, those people focusing on ensuring quality healthcare. Connect us to those people. Let us know, because I might not know someone right? Or an organization So it's good to get these contacts so that we can be able to bring them on board. Okay. And the challenge is still there. It's still on the sponsorship challenge. You bring one sponsor, you get 5% of the package you sold, right from the title sponsor, which is $100,000, and then diamond, which is $10,000, and then platinum, which is $7,500, and then gold, which is $5,000, and then silver package, which is $3,000, and then bronze package, which is $1,000. Okay, so any sponsor you bring in, 5% commission. And apart from that, of course, there are opportunities of you knowing them knowing you. There's a shift of perception every time you talk about ideas or initiatives like this to people. Okay, and like when you go there to search to look for employment. Okay, I don't know if you have ever experienced that, but I know you are familiar with I don't know if it's a proverb or a simile, that you are needed when you have. Okay, you're always needed when you have. That thing is very real. Okay, I urge you this coming week, try that. Try talk to people about healthcare access workshop. Try talk to people about the Actuate Summit. They are ready to sit down and listen. Unlike when you go there and say, I want an internship, the conversation is totally different. Okay, so you have something right now. So I want to tell you that you are needed. Okay, so yes, this opportunity is around you. Can you seize it? All right. Maximize it, and for your benefit, and also for the benefit of our continent at the end of the day. We are also having exhibitors. There is a space for exhibition, of course. So bring us these people who are doing something at the end of the day to improve health access. Those people, innovation, with innovations, how to solve healthcare access challenges, right from even pharmaceutical industries, which are offering affordable drugs. They are solving healthcare access by providing affordable drugs at the end of the day. And all other people with good operations in Africa on health access, okay? And then now attendees right from you and your network and all those people, connect us to these academic institutions. We want first of all learners, because this is where the next generation is. Learning institutions, that is where the next generation is. And Web3 is here to ensure that the next generation is not going to be slaves. The next generation is going to be in liberty, okay? So we are targeting institutions because that is where that is where the potential is. That is where the potential is. So we want to ensure that and the summit get attention to as many learning institutions as possible. Okay, we are in talks with UON, okay, KU, and even JQuat, all those faculties in health and human development, and even tech. We are in conversation to ensure that we have attendees, learners being in this summit, because through this summit, through these conferences, through these discussions, conversations, that is where we are going to give birth to the next empowered generation, all right? The next free generation from this slavery of centralization of information, centralization of finance, centralization of everything, okay? Yes, so we need to ensure that Kenya, Africa is ahead of the curve. Our youths are ahead of the curve, are informed. Okay, so connect us. Let's have that discussion. Let's work together. Let's collaborate in reaching out. Let's be ambassadors. Let's be evangelists of the Actuate initiative and also the Actuate Summit. Okay. Yes. So also we are inviting you to keep on applying for the poster presentation. All right. I see a lot of potential here. All right. By making time to attend this Learn to Earn session, I am believing that it's because you believe in something. You believe that this blockchain technology has immense potential of setting free our continent. I believe that is why you are here today. All right. So please don't miss out this summit. Poster presentation is going to place you to a very high place. All right. So visit our website, interact, learn more about the poster presentation activity, what is needed of you, the criteria, then come up with something before that time. All right. There's so many benefits, networking, even grabbing yourself a ticket for next year summit. Do something, okay? Come up with an idea, and who knows? Because when you look at the criteria, is that you must have a model at the end of the day, the innovation model. How you gonna roll this thing up to the where the people are gonna interact with your innovation. Okay, so that now we can realize the effect. Okay, so learn more, come up with something, and it's not always impossible. Nothing is impossible. All right. Yeah. So ensure that you have something. Don't say that this is impossible. I have this idea. It is impossible. Nothing is impossible. When you look at what people are doing, people like Bill Gates, people like Elon Musk, those people have a certain mindset, all right, that if we all have that mindset, I think the world is gonna go far, right? So don't fear losing yourself, because if you fear losing yourself, you will lose yourself. If you don't fear losing yourself, then you will have yourself together. Okay. Yes. So come up with an idea, do something. Don't bother about the resources. Everything will align itself. First of all, believe in yourself, come up with something, show the world. And who knows, right? Yes, I want every Actuate member to, all of us to have that mindset, okay, of possibility, all right? That is the only thing that is gonna keep us going, keep us successful in this journey and set our continent free, all right? So please, and we are landing so many partnerships taking place, so many signings, agreements taking place. Okay. Already we have Infotech workshop sorted out. Mental health is sorted out. Environmental health, we are closing. Water, we are closing. Health access, we are closing. And even blockchain now, the main blockchain workshop, and all other things. Okay, so please, okay, do something, join us, be curious, and all those things. And I think by this month, there's so many things that are gonna happen this month going forward. We are also having a plan of coming up with merchandise, clothing, the caps, hoodies, and even t-shirts. The dressing, clothing with messages about translation science, messages about DeFi for mental health, DeFi for health access, DeFi for STEM, and all those things. All right. So a lot of amazing things gonna happen, and we want you to be part of this. We want this merchandise to move, to spread. So be on the lookout, okay? Start being curious, start being excited, start warming up for more things, all right? Yes, so that is it from me, and back to you, Glory. Thank you so much, and have a good night, everyone.
Thank you. Wow. Thank you, Augustine, for those comprehensive updates about the summit. Yes, Augustine has said it all. He has explained on how everyone can participate, and you've had the partners have already secured, and yeah, we are almost getting there. It's becoming true. So let's all strive to participate, whether it's being an ambassador of our summit, whether it's looking for exhibitors, sponsors, and also participating as poster presenters, because now this summit, it's ideal now for the idea sharing. That's where now we can voice our that's now where we can share ideas on how we can now adopt this our Actuate token now to come up with all the benefits that we have talked about the national health. So I encourage all of us to participate, because there's nothing about us without us. So Daktari, you have anything to add about the summit? You're welcome.
There is nothing about us without us. Did you hear? Can you hear me, Glory?
Yes, yes, Doctor, we can hear you.
Oh, there's nothing about us without us. I never heard that. I thought there was something about us without us, but now I know. So there's nothing about us without us. So we are the ones. That's great. Great statements. Thank you so much, also Augustine, for all that explanation about this summit. I think the Health Access Summit, I think is going to be the most powerful of all. That's the workshop, the Health Access Workshop itself. Because remember, Actuate is about health access. And you can see it is in the Health Access Workshop that whatever we've talked about today is going to unfold. It's going to be laid there. It becomes going to become clear for all of us. So that workshop is going to help shine the light to what Ronald Anthony is talking about and what we have talked about, Actuate token itself, creating universal health access. So just want to emphasize that and underscore that the summit itself, the workshop on health access, will take us through 3 days of intensive, deep thinking. So it's a workshop. People are going to be working. What is working is the neurons, your brain. Bring your brain power. Don't leave your brain power at home. The workshop is active participation. So you bring yourself. As Gloria has said, there's nothing about us without us. So what say when with you or with us means that you bring your entire consciousness with you. Because with you indicates your consciousness, what is within you. There's nothing about you without your consciousness. That's what is it about you. All right. So what does that mean? Is that this workshop itself on health access is going to give us a way on how we produce universal health access for everybody. That means everybody has got access to health. It's going to be 3 days of intensive deep thinking and deep working. So everybody has to work together. So bring your thinking cup, bring all your thinking brain, bring all your thinking neurons, bring your everything thinking. Bring your entire consciousness, bring your entire being. Okay. Leave nothing at home, right? Bring it with you because your brain is needed to be there, or your thinking needs to be there, or your consciousness needs to be there. So when you come, the very first day of the workshop, the health access workshop, we shall say, what will the future look like when we have universal health access, that every one of us can have access to health? Remember, this time you're not in the learn to one session, you are in the middle of very many people. You meet very many people. And we want to talk in the midst of that very many people, so that the knowledge that the new mathematics is absolutely necessary. It's required for universal health access to manifest. See that it's required, it's necessary. It's absolutely necessary for people to comprehend that we need the new math. But people already have that idea within themselves. But we want that workshop to bring it out of them, so that they can say, we created this future, the vision of the future together. Okay, but creating does not come from just imagining it. So the first day is a day of imagining that future, working with people through a facilitated dialogue process. And this is where our workshop leader is going to lead people through that dialogue, so that we can come out with that future, where universal health access is actually real. It's not something we talk about. It's something that actually happens. So the second day, we'll talk about the problems that are happening today, the current reality. And that is looking at what the centralized system is doing, centralized health system, centralized finance is doing. And that centralized finance system, we now look at the problems that with the centralized finance system that is only able to cover 10% of the taxable population. The rest of the population are outside, extra legal. So that's the second day, and we have to ask ourselves, why are we having 90% of the people being extra legal? And it's because, not because anybody is committing any crime, it's just because of the theoretical foundation, the way we understand how we do the things we do. And then we say, we must have to change the way we do the things we do. So we go to day 3. And day 3 is the day where everybody comes and says, let us create a roadmap to the future. The future we saw on Monday, on the first day, the future that we saw on the first day, whether we have universal health access for everybody, where the blockchain itself, using the Actuate token, makes that future possible. And then when you all draw that together, we co-create the future. That's the idea, that the summit itself would help us to co-create that future together, because co-creating is the most effective way of communicating our vision. And that's why we want these workshops to be co-creation workshops, the workshop for creating the future together. That means bringing that future that we truly want to the present. So we talked about that briefly last week, bringing the future we truly want to the present. That's what it's about. And you can see these learn-to-earn sessions are helping us to unpack the summit, bit by bit, so that by the time we come to the summit itself, every one of you, every one of us shall be knowing what is happening, what is going on, shall be having a clue, shall be clued in. Clued in because there's 2 conditions. One condition is called condition of cluelessness, like I have no clue, clueless. Why do we have 90% of people being extra legal? I don't know. Maybe they don't want to be legal. Yeah, it's not that they don't want, it's that the mathematics that we use today for economics has no clue. It has no clue. It has no clue of how to get everybody on board to get universal coverage. So we're talking about mathematics that has got a clue, the mathematics of randomness, and that is going to give us ability to include everybody in the fold so that we have universal health access. Now, so the mathematics of having a clue is what we have. And you also have a clue because you're here today. So now your job, say you kids, what am I supposed to do with all that? That's what you're asking now. So what am I supposed to do with all that? What you're supposed to do with all that. 1, tell everybody you know. Go and tell it on the mountain. Tell everyone, over the hills and everywhere. That means be the evangelist, like what Augustine said. Your work is to preach the word, the gospel. So spread the word to everybody you know. Go and tell it over the mountains, over the hills and everywhere. All right. So that means that you tell everybody, your relatives, your professional colleagues, your possible employers, your classmates, everybody, people in your social network. Tell them, because they shall be knowing that you knew these things and you never told them, and they'll be asking you, why did you tell us? So you want to start up in the mountain and tell everybody, spread the good news of that the technology that can help us to get included, universal health access, is there today. So teach people how to get wallets, teach people how to get tokens. And if they are not getting tokens because they're not in the learn-to-earn session, add them to Actuate Nation so they can be coming to the learn-to-earn sessions. And then also they can buy those tokens directly from the liquidity pools, in PancakeSwap. So get their people on board, because I can tell you, the floodgates opened, that the population start getting in, those tokens shall be expensive and maybe even unaffordable. You don't want them to be expensive and unaffordable. There are going to be many ways of earning them, but because you are clued in, you've got a clue, you know what's going on, use that clue to get other people in the clue. Okay, so clue in everyone else that you know. So then make a poster, of course, because you make a poster that the poster is going to be stimulate the conversations, these deep discussions and dialogue process. In the facilitated dialogue, the posters will help a lot. And of course, by creating a poster that has got your name on it, you get credit that will lead you into even higher places. Okay. So that is what I would like to add about that. And I think everything is going on very well. You know, this thing, how it occurs is like what? It's like when you plant a seed stays under the soil, it's buried. A seed is buried under the soil. So you can say we are in the stage where the summit is buried under the soil, it's waiting to sprout. And then when it's gonna sprout out there, it's gonna germinate, sprout, and let's be enjoying the sunshine, all that sunshine. So that will happen on the day of the summit when it sprouts out. So when the seed is under the soil, some of the seeds get emotional, they get really anxious. Shall we ever see light in our life? Shall we ever see daylight? Because the seed is covered, is buried. It's like in a coffin and buried out there under the soil. So it just needs to wait. And I think for the seed to germinate, it needs water, you know, it needs to be, you know, it needs to have sufficient water and oxygen. So the soil is good and needs fertile soil. So right now in Actuate, we have fertile soil, you know, which is, and then there's water. We have people moving, talking to companies and organizations and individuals, telling them about the summit, spreading a good word. Those are the inputs that the seed needs to go to the soil so that the seed can germinate, and the seed is germinating. As you've heard from Augustine, several organizations already have agreed to lead the workshops, different workshops. So, and of course, if several organizations they are ready to lead the workshops, we are also going to access a lot more people through those organizations. Yes, so you know that you are in for a very great time and you have a clue. Yes, because you have a clue, you already have a great advantage over everybody else. All right, so I think let's stop there, and we keep talking about this, all the good news, and spread the word. Like I said, be the evangelist. Be the evangelist. You start the mountain, because we are never going to achieve universal coverage if people do not know what Actuate is all about. Okay, well, that is all for today, and thank you, Glory.
Thank you, Dr. Ari, for those wonderful remarks. Thank you for making time for this meeting, and thank you for always having people's needs at heart. So thank you to our topic master. Thank you everyone for joining. As Dr. Ari has said, let's continue spreading the good news. Let's be evangelists everywhere so that more people can know about this and participate in these conversations. So the Google form has been shared at the chat box. You can fill. Yeah, we incentivize our learners. We award you with our precious tokens for joining, for coming to learn. Yes, so make sure you fill so that we can allocate our tokens for you. So once you leave, you are free to leave. Let's meet next week, same time, and let's continue the conversation throughout the week over our social media platforms. Let's ask, you can, in case of any concern, maybe you are approaching an exhibitor or a sponsor and you want guidelines, always feel free to DM me anytime, any day. So yes, once you fill the form, you are free to leave. Let's meet next Thursday. Bye.